I think I always start the day with a positive attitude. So the patients appreciate that. They say that a lot, that you're always smiling when you come in here, which I think is good in this environment. People are coming in and they're in pain and they're not feeling their best. So we try to, change that mindset and let people know that, we're here, you're here, and we can help you. I think I try to approach patient care as a collaborative endeavor so that we're working with the patients to figure out the treatment plan that works for them, not just based on what we see on their MRI or, the pathology necessarily, but where they are in this process, what they want to do, how interventional they want to be about things, try to meet people where they are. I think they appreciate it. Yeah, I do hear that quite a bit from patients that, you really explain this to me in a way that no one has before. And this is sometimes coming from patients that have seen multiple providers. So, there are a lot of options in Boca. There are a lot of medical providers. So, I think something like that really stands out. I think that's the reason a lot of people come back to the practice. I think when you're dealing with spine, in many cases, we can't fully fix the problem, but I use it as an example, somebody with very severe scoliosis, that if they're not going to have surgery for that, we cannot correct the problem necessarily, but we can manage the symptoms and give them a better quality of life that way. And that's something that we try to explain to the patients all the time as well, is that even if we can't fix this, we can give you a quality of life back and we can manage your symptoms. That's really how we measure success a lot of times with spine, because again, these are chronic conditions, is that can we give you some functionality back? Are you able to start golfing again? Can you play tennis? Can you play pickleball? Can you play cards with your friends? That's really the measure of a lot of what we do. And I think we see that all the time. But yes, in general, if people don't come back to pain management, then that's a good sign. That means you've done your job. Because we're dealing with chronic conditions a lot, we do see people a lot, and there are patients that I have, known for 5+ years since I've been here. But if we can help them to, not have to come to the doctor so often, obviously that's a good outcome.